we are here to critically review interventions already implemented and the challenges still facing us, and come up with strategies to accelerate improved universal access to HIV prevention, treatment, care, and support. It is in this context that I have been requested to speak on the topic, elimination of new HIV infection among children by 2015. What will it take? I will give my response to this question and make my meager contribution to the objective of this important conference in my capacity as the President of the Organization of First Ladies of Africa Against HIV and AIDS, OFLA in short. 10 years ago, Africa was a continent that was most adversely affected by HIV and AIDS. I feel privileged to be one of the 37 African First Ladies and the representatives who gathered in Geneva 2002, where the OFLA, which I am current president of, was established. The aim of establishing OFLA was to seek and reinforce policies and programs against HIV and AIDS through advocacy, resource mobilization, and the development of partnership with stakeholders at all levels. In 1997, the Sub-Saharan Africa region was the hardest hit by AIDS epidemic. It was in this challenging context that OFLA was established. We are all happy to note today that with the collective efforts made by all stakeholders, new HIV infections have dropped by more than 26%. However, we are still left with critical challenges to address, especially in the 22 high-burdened countries, including Namibia. Our point of departure in addressing these challenges should include the following. Firstly, I think there is a need to determine strategies to address the challenge of fragmentation and duplication of activities, particularly at country level. A lot has been said and much is happening at the community, country, sub-region, and global levels. It is indeed commendable and so encouraging to see everyone working in this challenging field. However, I have observed that there seems to be duplications of fragmentation and programs, projects, and activities. I am tempted to believe that sometimes the impact of what is done might be negatively affected by these fragmentations. Secondly, strenuous efforts must be made to enhance a holistic approach to the delivery of mother and child health, MCH in short, and reproductive services. MCH and reproductive services are very crucial to the reduction and elimination of new HIV infection. Our services must be organized well so that when a woman visits a health facility, she is able to receive all the services from the same site along with her child. Thirdly, there is a need for a more urgent and exceptional response that considers strong HIV prevention and the universally accessible treatment working hand in hand. We know that there is an increase in the rollout of antiretroviral therapy across the sub-regions of Africa. The commendable results in the treatment of AIDS. For example, countries such as Botswana and Namibia have attained over 90% coverage in terms of treatment. However, prevention of HIV and treatment of AIDS must go hand in hand. Treatment alone, without reduction of new HIV infections, is not sustainable in the long run, because the number of clients needing treatment will keep on increasing. Fourth, governments have to increase their local financial capacity towards the responses to the HIV and AIDS. Africa, particularly Sub-Saharan Africa, must build on the progress already made to be able to, in the context of the global financial crisis, identify and fill the financing gaps left by donors. The economic impact of the crisis has caused damage and setback, and might continue to impede the progress for many more years to come. Given the context of the global financial crisis, therefore, African countries cannot continue depending on international funders alone. We have to make considerable innovative efforts at country level to mobilize and leverage local resources to improve their socio-economic development. It cannot go without acknowledging the response of the international organization and the community to minimize the impact of the financial crisis. However, there is still a need for the commitment of the international funders to be reinforced, especially towards the PMTCT interventions and making antiretroviral drugs accessible and affordable in Sub-Saharan Africa. Fifth, the involvement of youth living with HIV and AIDS must be broadened to participate at levels of planning, management, and implementation. Children and youth on our continent do not seem to be given adequate attention. Their involvement remains limited, and yet the global statistics shows that 90% of the 2.1 million children infected by HIV live in Sub-Saharan Africa. These children are rapidly reaching childbearing age. This should be our concern, especially since there is a high rate of teenage pregnancy. This puts our girls at a high risk of giving birth to HIV-positive babies. Fortunately, our youth have these days a better access to information relating to HIV and AIDS, sexual and reproductive health. However, they should be actively involved in the prevention, treatment, and care interventions. They must and can play a pivotal role in the elimination of new HIV infection. Sixth, the involvement of men and women living with HIV and AIDS must be broadened. We must embrace those living with the virus openly. We must make sure that they participate at all levels of planning, management, and implementation. Lastly, male involvement in the elimination of mother-to-child transmission agenda must be strongly promoted. It has become high time that our male partners must seriously come out of their stereotype and be brought on board to be part of us and join forces and act now. HIV and AIDS has neither cultural nor gender boundaries. We are all equally needed to do business as usual to enhance cultural and behavior change for the sake of eliminating of the HIV infection. I will take the collective focus of all of us to reach a new generation with zero HIV infection, zero stigma and discrimination, and zero HIV-related deaths. And together, we can do it. I thank you for your attention.
Thank you very much, Madam Pohamba, the First Lady of Namibia. We've learned 7 key things that we can do if we will eliminate HIV infection amongst children by 2015. We have to determine strategies at country level. 2, we must enhance delivery of maternal and child health and reproductive services, and we have to integrate so that all our services are at the same point. We must keep talking about the urgent need for antiretroviral therapy. 4, we must increase government spending. I love that. Local money must be spent on local problems. We also need to have renewed and increased funding by donors and international partners. Number 5, involve young people in program planning, design, and implementation. We must involve men and women living with HIV beyond them just being program recipients. And 7, she says, male involvement in maternal and child health, male involvement in preventing parent-to-child transmission. It sounds to me like men must do more than just make babies. They have to take full responsibility. They must take leadership here. So we are going to open this up now to comments and questions from the house. There are microphones all across the room. So if you'd like to ask a question or make a comment, please do so.